course, there are a lot of information, but I think immunotherapy is one of the issues here. And it's in transplant, the role of the bacteria in the gut is very interesting also. And molecular developings, how to kill the stem cell in chronic granulocytic leukemia, that's very interesting. The stimulation of your own system, immune system, it's important in treating leukemia, lymphoma, myeloma. That's very exciting. Well, it's complicated. I think that many hematologists have their own interests, you know. It depends how your people you're treating, you're dealing with. If you are a general hematologist, oncologist, maybe we complicate because you would like to go to see any presentation. But I usually choose the topics that I'm more interested, like my person is lymphoma and transplants, maybe myeloma also. Well, it's a big meeting, and of course, I think it's very important. And I think it's a little different from the one who is in the United States. Maybe it's more, you know, you say, with your feet on the earth. I like it. Oh yes, especially if you have interest in hematology. If the young student is with some, you know, tendency to go to hematology or oncology, it's very important. It's just, you will see big people, old and young, working, and that's a field of learning how to give presentations, new developments, how is a big congress. Is important. I think it's important. I think it's in some cases the most important thing that we can get it. I have had experience doing that, discussing patients or protocols or research with our peers here, and that's very important. Sometimes you are going back home with some pearls or diamonds in a scientific way, and that's also very important. That's why the main reason I'm here is because of that. Oh yes, a couple of posters, yes, and one of them is regarding the treatment, different treatment of autoimmune hemolytic anemia. And the other is the difference between people who has money to pay for drugs with myeloma, suffering from myeloma, and people who has no chance to the new drugs, and how this impact in Mexico, because there are some people who has private insurance who can deal with the cost of new drugs, and people of a public institution that is not easy to get drugs. I think this is also occurring in many places in the world. But we compare the data from poor or not so poor people, you know, and this completely different. People who has chance to get the new drugs are doing better than people who is not. But we compare in our field of action in our city with the same team treating people with new drugs and people without drugs, and we show that it's different. It's sad to say this. That's important in order to convince our fundings or government that we need to do more for that kind of people who has no chance to get the new drugs. That's the other poster that we get here. Always, and there are a lot of meetings, and it's not easy to obtain fresh information when you are in several meetings. But in this kind of meeting, especially this one, of course, there are several fresh and new information, new data from a new treatment for leukemia, for example, new developments in transplant, new developments in lymphoma. Of course, there are a lot of fresh information, and it's a small one maybe, but very important. Well, challenge maybe is there are a lot of advances in diagnostic tools and drugs. Maybe the problem, because I'm living in a middle-income country, is the access to that kind of stuff. How to deal with the problem of accessibility. That is facing not only in Mexico, I know in England, Spain, France, Italy, for example, I know, and in the United States, because we live close to the United States, there are some people in the United States who cannot get the best treatment or best diagnostic tool available. And I think this is a problem. We must have include some of this kind of discussion in these big meetings, because it's really a truly international meeting. How to develop systems or politics to bring the best treatment or best diagnostic to people who is far away from that. Well, several, and until now I expect more in the next days. Regarding the use of new therapy for leukemia. Sometimes you are not getting a new information, but consolidate your own believing in a treatment, And this is one of my messages. Feel secure that we're in the right way, and obtaining some tricks, tools, new information in order to move our therapy to another direction. Oh yes, of course, we have always several messages to get to home.